What's great about strength training is that it can prevent common running injuries. So we're talking about injuries to your calf, Achilles, ITB, back, knee. Now, if you run regularly, you've probably come across a lot of these injuries, and in some cases they may have stopped you from running, which can be frustrating because you're getting your mileage in, you're getting your training in, and then niggles start to appear. And they get worse and worse and worse till going to the physio and drastically reducing your running volume is the only option. It's important to understand, though, that a lot of these injuries are caused by muscle overuse. Muscle overuse is a result of a movement pattern done over and over and over again. And for distance runners, that movement pattern is running. Muscle overuse is an indication that the body is crying out for variety in your movement. It's looking for something different to do. So if we take the idea of the IT band, for example. The IT band is a connective tissue that runs down the side of the leg there. And due to overuse, through running, this can become very painful and tender for runners. Now, apart from going to the physio, which is what you should do if you get this, you should get it treated by physio. Well, common treatment is a foam roller, where you're rolling out the IT band, which has a lot of acute benefits, but you're treating the symptom, not the cause of the problem. The cause of the problem, more often than not, is up in the glute and the weakness in the glute. So how do you strengthen the glutes? Well, you can do your hip thrusts and your clamshells and derivatives of those exercises, all great exercises, and I use them in most of my programs for a base level of strength. But if you run a lot, you probably have to take it a step further and use strength training in a full range of motion, because if you use strength training in full range of motion, and I'm talking about split squats and full squats, then you give the body the variety of movement it's craving. And you also get the weak muscles that have become weak through lack of use in running, get them working together with all the other muscles and get more muscle recruitment and get all the muscles really working together. So if we take the split squat, for example, placing your foot on the step in this position here, making sure your torso is tall and making your posture very good, you go all the way down, all the way down, all the way down until your back, the hamstrings touch the calves and you've got a bit of flexibility, you feel the stretch in the hip flexors, and all the way up again. You're working most of the quad, you're working the adductors as well, you're working the glutes, and all that muscle recruitment is taking the strain off the IT band and bringing more structural balance to the leg, and therefore less pain. And it's also the same case for the full squat as well. So take the goblet squat, for example. Make sure your posture's tall, keep your knees out when you're doing that, so keep your knees out to recruit the glutes again, go all the way down, keep the chest nice and high, all the way down the back, the hamstrings touch the calves, and all the way up again. Again, you're using so much muscle recruitment that you're taking the strain off the IT band and bringing less pain. Okay? Once all the muscles are working together, then there's going to be less overuse and there's going to be more muscle recruitment, or they're all going to be helping out with each other. Muscle overuse, remember, muscle overuse is an indication the body is crying out for variety in your movement, or variety in your range of motion. And if distance runners use these exercises, developed the flexibility to go into a full squat, went deep into a split squat, then the occurrences of these overuse injuries would be far less prevalent in distance running. Thanks for watching.